Okay, so I think we can go ahead and get started. We're talking tonight about social media and how we can use it to bolster the movement for single payer Medicare for all. And we have two terrific presenters tonight, Dr. Monica Maalouf, who is president of the Illinois chapter of PNHP, is going to talk about her experience using Twitter and some things that physicians should be aware of when using social media. And Edward C., who's a medical student and executive board member with Students for a National Health Program, is going to talk about his experience using Instagram and how all of us, everybody here, can create visual content, even if you don't necessarily think of yourself as an artist. But first, I'm going to kick us off by talking about some general principles of social media and how they apply to the work that we're all doing for healthcare justice. So let me go ahead and share my screen because I do have a presentation. All right, and you should all be able to see that, I hope. All right, perfect. So a few housekeeping notes before we get started. The first, this is being recorded. And we will email a recording of the training to you after it's completed, likely tomorrow, and to members who weren't able to make it tonight. The chat is open, so feel free to interact with one another in the chat. We may not always be able to respond, the presenters, especially if it's while we're presenting, but I'll try to put some resources in the chat and some links as we go. And we want this to be interactive. So each of our presentations is going to be about 10 minutes. And then after we all speak, we'll have 10 minutes or so for questions. When we get to that portion, I would just ask that if you do have a question, you use the raise hand function so we can keep that sort of orderly. So what is social media good for? Or more specifically, what is it designed for? I want to take a look at some of the defining features of social media, regardless of which platform you're using. So first off, social media connects you to a specific audience. Every time I post something to the PNHP Facebook page or Twitter account, I think about who's going to be seeing that post. We have a lot of physicians who follow us, obviously, medical students, people throughout the health professions. That's definitely all part of our audience. But we also have a lot of health justice activists outside of the medical field, people who believe in Medicare for all and want to amplify our message. And when we started talking about Medicare direct contracting last year, we saw an influx of seniors who weren't previously connected to PNHP, but who wanted to learn more. So when you're thinking about your audience, it might be useful to come up with different personas to make this group of people that you're talking to a little more concrete in your mind. Think about some of the defining characteristics, things like age, race, ethnicity, occupation, other kinds of activism that they might be engaged in. If you're managing a social media profile for a local PNHP chapter, then you already have a head start in terms of geography. But you can definitely divide that up even further in terms of where people live specifically within your region, what neighborhood they live in, et cetera. So try to come up with a dozen or so audience personas based on what you already know about your audience. And I think that will help you in terms of crafting your message. Another defining feature is that social media is social. That's what it was designed for. So I was just using the term audience, and that makes it sound like social media is a broadcast medium, but it's not. Now, there are some large entities like, say, the New York Times or Kaiser Health News that will use their accounts more for one-way communication. But we're not, that's not a club that we belong to or that anybody on this call belongs to. And the vast majority of accounts really work best when they seek out interaction. So you want to ask questions, you want to respond to comments, you want to share posts from other accounts. Now, you might even consider setting up a private group in Facebook if what you really want to do is organize among a small and select group of activists. So that's an option as well. But I want you to take a look at this tweet from the All on Medicare account, which is just an account that's run by a single person, an activist, who, believes in Medicare for all, and it asks a question. When did you become radicalized by the US healthcare non-system? And it generated thousands and thousands of responses. Now, if this tweet was written as a statement, it wouldn't have attracted nearly as much attention. It wouldn't have attracted engagement. People wouldn't have felt compelled to respond to it. Sorry, let me move on. Okay. All right, so this one is crucial. Social media is visual. Posts, photos, graphics, and video, they all make a big impression on social media. And not just on the overtly visual platforms like YouTube and Instagram. Visual content makes a big impression on all social media platforms. So for example, if you're posting an op-ed that one of your members wrote, I'd encourage you to think about what image accompanies that article. If you put the link on Facebook, you'll see something pop up, but sometimes it could just be the logo of the newspaper, or it could be something totally unrelated. So think about developing a simple graphic or taking a screenshot of a paragraph that you really want to highlight, and that will serve you better than whatever image the media outlet puts up for you to use. It does make a difference, and you can see from our Facebook metrics on the right here that posts that include a photo rank the highest in terms of how many people they reach. Another defining feature of social media is that it's collaborative. At PNHP's national office, we know that social media can and should be used to impact organizing, fundraising, and other types of communication. That means we work together as a staff to incorporate social media into whatever campaigns we're working on, direct contracting, for example. And we also use feedback from social media to inform what we're doing. So if there's something that we really think is going to resonate with people and it doesn't, everybody on the team should know that. Or if there's something that we think is not necessarily going to resonate with people, but it does, everybody should know that as well. At the chapter level, you can work with local members. You can work with people in your networks who might want to volunteer services like graphic design or videography, and you can work with the national office. And speaking of working with the national office, I hope you saw an email that we sent out earlier today. We just launched a communications toolkit for the upcoming July 30th Medicare anniversary, where many of our chapters will be pushing back against direct contracting and reach and the overall privatization of Medicare. So that toolkit includes some graphics that you can post to social media, includes some suggested text, it includes a sample press release, and I'd encourage you to take a look at that. If we have some time later on, I might show you some more specifics there. Finally, one of the real benefits of social media is that you can quantify how you're doing. There are caveats, of course. We're all at the mercy of the algorithm, and the companies that run these social media platforms set the algorithm to maximize their profits. But that being said, if you look at the analytics that are available to you through whatever social media platform you're using, then you can get a good idea of what messages are resonating and which ones are not. So for example, we have this regular debate about, should we be using single payer? Should we be using Medicare for all to describe a national health program? But if you use this tool called Google Trends, you can see what are people actually searching for. And you can see over the last 12 months, Medicare for all is the favored term that people are searching for among the two. But if you go back to 2004, you can see that the term single payer in the red had its spikes as well. So it's useful to kind of check your assumptions and preconceived notions, and also to see how the posts that you're putting up are doing. There is one other thing that I want to stress, and that's even though social media takes place entirely online, there's a good deal of offline work that really needs to take place in order for your accounts to be successful, especially at the level of a chapter account or even the PNHP national account. And that is, once you have your profile up and running, you have to be sure to promote it and link to it anywhere and everywhere you can. You want to use your website, email blasts, email signatures, personal emails to people, conversations, Zoom meetings, public events, any and every avenue that you have to get the word out about social media, you want to use it. In fact, I'd say if anybody on the call has a social media account that you manage, feel free to put that link in the chat so we can all see and we can all be sure that we're following one another. Building an audience this way is slow and steady, but it does work over time. And something that I want to leave you with is the rules of three, right? So after tonight's training, I'd encourage you to do three things. I'd encourage you to choose 3 goals for your social media channels. And these can be simple or they could be advanced. It depends on where you are. So these can be start a Facebook page, right? Or if you already have one, you might have more advanced goals. I'd also encourage you, if you're at the chapter level, to identify 3 people from your chapter, or if you're not, from your personal network who can work on social media in some capacity. This is going to be a whole lot better and a whole lot more manageable if it doesn't all fall on one person. And finally, I'd encourage you to reach out to me in 3 months so we can talk about, how you're progressing on those goals, check in, see what's working and see what isn't. So with that, I want to kick it out to you and encourage you to use the raise hand function if you have questions. I'd be happy to address those. And I will stop sharing my screen so I can see any questions. Okay. All right. I see Leo, you have a question?
Yeah, hi, Dixon. It's good to see your face now. You were just a name in my email list before. So I'm an older guy, but we have, we started the Florida chapter just last year. There's some younger members that I think use Facebook and things like that. Is this being recorded? Can they reach out to you for guidance and assistance?
Yes, they can absolutely reach out to me for guidance and assistance, and it is being recorded. So we're going to send the recording to all of you and to people throughout membership this week, most likely tomorrow. And I will put my email in the chat so anybody can feel free to reach out to me with specific questions.
Great. Thanks for putting this together.
Yeah. All right. Any other questions for me? Okay, I see Howard.
Yeah, I'm probably an outlier and feel free to refer me elsewhere, but I don't even know the most basic thing about getting onto social media or using it in even the most rudimentary way. Is there some place I can go to learn that, like Social Media for Idiots or something?
Yeah, I think so. Hopefully some of the subsequent presentations here are going to be useful for you, because I know that Dr. Maalouf and Edward are going to be talking about some more specifics, but I see that we have a few minutes before I'm going to kick it over to them. So what I would like to do is just share my screen again and show you an example of how to use our social media toolkit that we just emailed out today. And that will give you kind of a basic of how to do a post. So hopefully that might be helpful for you.
Howard, while Dixon's loading that, I'll say too, I think if you're just getting started, it's good to pick one platform. Either you're going to do Facebook or Twitter or Instagram. I think Facebook and Twitter are probably the easiest ones for a new person to jump into, but kind of picking one platform and going from there. But I'll kick it back to Dixon here.
Yeah, that is definitely good advice. There are all sorts of platforms and you should not feel like you have to use all of them or even more than one. So I mentioned the email that we sent out earlier today, and this, you should be seeing it on your screen. The subject line is everything you need to celebrate the July 30th Medicare anniversary. And if you click on this view our communications toolkit link, it will take you here. So there's a lot of good stuff in here, but I want to scroll down. The media advisory stuff is super great. My colleague Claire put this together. So if you're doing an event, please look at that. But when we get down to sample tweets, these could be used as Facebook posts as well, and images. sample graphics. I'll just show you how to basically use this. So let's say, we've got this graphic here. It says Medicare turns 57 this year, but Wall Street is trying to crash the party. If you click on this download link, it'll take you to this page. If you click here to download, it will download that image. And then we've got some suggested text here with 5 different versions of which you can choose the one you like. I'm just going to pick this one, copy it. And if you go over to Twitter, this is the PNHP Twitter homepage. I'll drag this out a little. So I'm going to click tweet. I'm going to highlight this little photo image at the far left at the bottom in the downloads folder where I just downloaded that graphic. It's going to pop up. I'm going to paste the text. And then you can just click tweet and it will, you can do it right away if you want to do this on the 30th. There's also the opportunity to schedule things. So, let's say I want this to go out on July 30th at, let's say, 8:08 a.m. Confirm, schedule, done. Facebook has a very similar function. You would copy and paste. You do the image from here, photo, video. You can paste the text right there. So that's essentially doing a Facebook post and a tweet for those who are unfamiliar. All right, so I'm going to do one more question. I see that Nancy has her hand raised. And then after we're done with that, I'm going to kick it over to Dr. Maalouf so she can do her presentation. Yes, Nancy.
Oh, thank you. I'm sorry I've joined a little late, but it's recorded, so I'll get number 1 and 2 later. But what I wanted to ask is, I've just recruited, I have one pre-med student and another one who's just come on board, and they're both willing to do. One has been doing my Facebook and Twitter and stuff for me, and the other one now is also interested. So what are you suggesting in terms of trying to coordinate that? What's happening is that I have been sending them things to potentially post, but now I've got the 2 of them, so I don't know how should one of them manage one account and one another, and the other thing is should they be somewhat independent of me? I'm having trouble keeping up with everything.
Yeah, I think it's a good question, and it's a good problem to have if you have multiple volunteers. I'd say, basically, I would ask them what they're comfortable with. It may be that they want to manage separate accounts. It may be that they, both want to chip in on everything. As a general rule of thumb, I think, if these are students and they've been managing the account for a while, and they've seen the sort of things that you've been sending them, and you can give them some kind of general guidelines to operate on, I think a bit of independence for them sounds like a good idea as well. And I'm sure they'd be able to run with that. But I definitely recommend forwarding them the communications toolkit. And I'm going to put a link to that in the chat so everyone has it.
Okay, I'm going to do that then. Yeah.
And see, I would encourage them, if they're young people, it sounds like, have them create the content and send it to you for approval. And then you can just say, go run with it.
Oh, that's a good idea.
Yeah. Just say, hey, here's some facts and data, make this into some clever tweets or posts. And
I have to be very basic here. How are they going to send it to me? Because I have trouble negotiating these sites myself. Can they send it to me by email?
Yeah, they can email you or text you and say, hey, do you like this?
Okay.
And then they can decide the rhythm and speed at which to post them. So
they can they join PNHP without being paid members? I don't know if they.
If they're medical students, they can, yes.
Oh, they can. Oh, that's,
yeah.
well, no, they're not. They're pre-meds. because we don't have a medical school here in Santa Barbara, so they're pre-meds.
I'm going to put the Snap link in the chat. And I want to say that's fine.
I think they can join Snap without being medical students for sure.
Nancy,
I'm gonna get started. Guys, I'm gonna get started with this.
She was a high school student, so I don't think, and there's no charge. So I think it's been done. But I guess that's up to somebody.
Guys, I'm gonna get started with the next part of this, but we can circle back to that question at the end if maybe somebody can find an answer. I think there's some good conversations in the chat. Some people were asking the difference between a hashtag and an @ for Twitter. And thank you so much, Betty, for posting a really good explanation. I'm going to share my screen and just talk a little bit about how I use social media as an advocacy space. Let's see. I lost my, let's see. Hopefully everybody can see this. Oops. Now I'm, there we go. Okay, there we go. So I don't really have, so thank you for Dixon for organizing this and for inviting me to speak. I don't have any expertise besides the fact that I spend a lot of time on Twitter and I tweet a lot about single payer and Medicare for all. But I'm going to talk to you briefly about how social media can be used as a tool for advocacy, and then some tips and things that I have learned through using it for several years. Social media can be great as a space for amplification of movements, a great community space for expressing opinions, mobilizing thought leaders, or what we in the social media world, what they call influencers, people with large followings, getting them involved in a movement and having them push forward agendas. And getting the attention of community leaders, institutional leaders, political leaders to push forward movements. A few examples that happened in the space of what's called Med Twitter. So there's a subworld on Twitter called Med Twitter, where people in medicine, mostly physicians and nurses and residents, are tweeting and tweet about medical issues. There was a controversial study that was published in this Vascular Journal of Medicine in 2020 that generated a lot of social media backlash and a lot of conversation on Twitter. I actually myself wrote an op-ed about this piece. A lot of people on Twitter commented on it, so much so that the journal's editors redacted the original publication and issued an apology. This is just one small example of how an online movement could create real traction in the medical space. Another example was through vaccine equity projects and COVID. Dr. Alice Stanford out in Philadelphia basically created a coalition of Black physicians to mobilize vaccine access for Black patients in the Philadelphia area when she noticed that there was a lot of disparities. And she got a ton of attention, 25,000 people vaccinated, and her local Congress people got involved, news stations got involved, and she really amplified through social media. For Medicare for All, as Dixon mentioned, I tend to use Medicare for All now since it's the most common sort of phrase used in the United States to advocate single payer healthcare. There's a lot of people talking about this on social media. Dr. Glaucoma Flecken, who is a sort of Twitter famous, internet famous physician and comedian, posts a lot of funny videos, but he recently posted a funny one about, the US healthcare experience, and it got 45,000 likes and over 1 million people viewed the video. Public Citizen is another big organization that does a lot of advocacy, like progressive advocacy, and they frequently tweet about single payer, really mobilizing and getting attention to this issue. So there's a lot of ways that you can use social media to create awareness of an issue, generate a following, and push forward meaningful change. So what are some tips for creating an effective campaign? I'm mostly again going to focus on Twitter, like how to craft a tweet, how to, start creating some content to get out there. The first thing I'll say is, and a lot of these are examples from my own Twitter, is use narratives. Stories are really powerful. They resonate. They're easy to remember. Facts and figures aren't. Saying Medicare for all will save us X number of dollars a year, Medicare for all will reduce administrative costs of healthcare. People don't like to hear that stuff as much as it is true. I like to intertwine mix in data and facts and cite studies when I tweet, but I always cite it as a secondary tweet. The first tweet is usually something more powerful and impactful. So this is example of, I posted a patient conversation, me saying, I think we should do an EKG, and the patient saying, I can't afford it right now. This got a little bit of traction. This is another example where I posted, my patient with cancer said, I can't afford my MRI right now because I have too many medical bills. You see you got a little bit of traction as well. So posting stories can be a lot more captivating for people on social media, rather than posting just those facts and figures. And this is much more powerful than me just saying patients can't afford their tests because they're expensive, instead anchoring it in an actual story. But I always make sure to anonymize things as much as possible. You can see that I don't even know the age, the gender, anything specific about the patient, so that the patient, or like what cancer they have, so it's not easy to identify the patient. But I anchor it in that sort of interaction that happened in my clinic. And then if you don't have stories, use other people's stories. So post stories from friends. This is an example of what I did here. Was I saw people posting their personal experiences on Twitter. This was when nurses across Twitter were posting about being burnt out and overworked and exhausted. And I kind of took little screenshots of their tweets and posted them. This is one where multiple physicians posted stories about struggling with prior auths. And so I captured them, I tweeted them, I said, this is what 24 hours in American healthcare looks like. And this got, close to 450 likes. Visuals matter. Dixon already sort of tapped into this, but rather than posting just like a whole article or a link to an article, a lot of times what I'll do is I'll take a screenshot of a headline and tweet that. This is another example recently where this was done really effectively. This journalist posted 3 screenshots of headlines, 150,000 likes, which is very sort of impactful, grabs your attention. This is a way that I like to display data. So if I'm citing a study, for whatever reason, I'm tweeting about a study, I take screenshots of the actual JAMA article or NEJM article or wherever the article came from, and I circle what I want people to pay attention to. I do this all on my phone through the iPhone Photos app. I just take the screenshots while I'm on my phone, circle it with my finger. And then for this one example, I said, in case you missed it, this JAMA study shows my chart messages are surging. And then I specifically circled, and then on Twitter, you can enlarge it and see like where I want to direct people's attention. And this is another one where I did that. I kind of underlined the highlights of the study. So show people where to look, show people what to look at, and you'll get a lot more traction than just like posting a link to a study. So I'm going to just spend 2 minutes talking about the no likes blues. So I like to equate social media to like the ancient Greek agora. There's like a huge marketplace where people are selling wares, out there, shouting from their soapboxes. There's politicians coming in. So social media really is a virtual representation of that. Sometimes you'll shout into the void and no one will hear you, but that's okay. Sometimes other voices are more important than yours, and that's also okay. Sometimes it's not your moment to shine. It's okay. It doesn't mean your voice and opinions don't matter. You should keep putting them out there, and I think contributing to the dialogue is what's important. Barack Obama, to put it in context, often has tweets that only have like 3,000 to 4,000 likes. And you may say, wow, that's a lot of likes. Well, Barack Obama has 132 million followers around the world. So, if Barack Obama can go to sleep at night with just a few likes, so can you. Put your voice out there and it'll grab attention where it matters. And lastly, just a few comments on like, if you're going to post stories about patients, again, anonymize things. Don't post pictures of patients. Doctors have gotten in trouble with it. Residents have gotten in trouble with it. My advice is time out before tweeting. Think about the audience and the goal of your tweet, and post the pearl, meaning like the clinical pearl for those of us, physicians who, remember what clinical pearls are, or like post the takeaway message. And synthesize the story down. Don't post about the actual patient themselves to get yourself into trouble. And if you want to delve into it more, the AMA has some guidelines about like thoughtful social media presentations and behavior. So I'm going to pause there and open up to questions. feel free to raise your hands. Yeah, that was like really rapid fire. All right, Leo Alonso.
Yes, hi. I like to listen to a lot of podcasts on, all these, how should I say it, pundits or influential people, and they all seem to be on Twitter. And the consensus I take from them is they have like this mixed feeling, like, yeah, it keeps them connected to their followers, but they also almost universally talk about it like this toxic element to it. Like it has this dark side. And can you kind of expand about that? Because I'm not on Twitter, but I find this commentary almost universal among the people that use it.
Yeah, I feel that way about all social media. I think you have to engage, you have to preempt it by thinking about your goals of participating, why you're participating, and really create a, be able to compartmentalize. I think that, whenever we post things in snapshots or in sound bites, kind of like I was showing, things can be taken out of context, or we might not see the whole picture, and that's always risky. Additionally, when you post things for hundreds of millions of people to see, you may suddenly get a bunch of backlash, and people may not like what you're tweeting about, and you may get a lot of negative comments. So there are a lot of downsides and negatives. So I think you have to go into it with like a healthy, thoughtful approach and know why you're doing it. I think that my social media use is very intentional. I use it to talk about healthcare policy, and I use it to talk about Medicare for all. And I try not to let it, leach into my personal life. I try not to take things too personally. And then if I encounter people who are posting a lot of inappropriate or offensive things, I block them off my account so they don't have to, deal with that. So I don't think it's a universal good, but it is right now our social marketplace where we can get ideas and thoughts out there. And I think it's a great space for amplifying advocacy movements.
What's the word limit on Twitter?
Oh, is this at like 180? Something 180 characters, I think. Patty Harvey.
Yeah, I have a technical question about Twitter. First, I just want to react to what you said about negative comments on social media. Like I do a lot of Facebook, and boy, did I get a lot of weird, crazy, stupid people saying weird, crazy, stupid things. But I figured it was a really good opportunity to practice being thoughtful, compassionate, kind, and informative without reacting emotionally. And it was really good practice to do that. And it's amazing. You have all kinds of people that pitch in and stand up for you when you do that too. And it's very reaffirming. But I wonder, I don't want to take up time with my technical thing about Twitter, but I can't seem to get my Twitter account going. I tried it. I actually signed up for it a long time ago, and then I forgot what the password was. And when I tried to go back, they wouldn't give it to me. And when I tried to get a new account, and then I put in my email. They said, "Oh, we already have your email. What's your password?" I don't know. And so they wouldn't let me change it. And so I can't use Twitter, which is really drives me crazy. So where can I go to straighten this out?
Yeah, that sounds frustrating. I would just contact Twitter support, give them your email address and say, this is my email account. I signed up for an account and you should just be able to Google like Twitter support.
So I could just Google Twitter support.
Yeah, and I have heard multiple people have this issue, and it's because Twitter tries to avoid having one person create like 25 accounts. So you're not the only person who's had this issue. So I think if you just email Twitter support, they'll be able to help you.
Thank you.
No problem. Elizabeth.
Hey, thank you, Monica. So I help run the Georgia PNHP Twitter. And so you're tweeting under your own personal account. But when we're tweeting under PNHP or a chapter of PNHP, when should we consider things that are conflict of interest for PNHP, or getting permission to post underneath the name or copyright or anything that is, because we're not tweeting under our personal name?
Yeah, I think that's a great question and a big gray area in social media. I don't know if Dixon, is that covered in the toolkit for individual chapters?
I'm sorry, can you repeat the question? I was looking.
Just
at the
about like,
Twitter help.
is there guidelines for when individual group like Twitter, so like the Georgia Twitter account for PNHP, do they have to get like any consent from the mother chapter before, like, is there any guidelines about that?
No, I don't think so. I mean, we have some general guidelines about, the type of content that we post. And we have some pretty strict regulations about, that relate to our 501c3 in terms of not, endorsing candidates or saying vote for this person, don't vote for that person. And as a matter of general course, we try to, stick pretty close to single payer or at least to health justice topics. But yeah, anything, I'd say chapters have generally free reign within those, within those parameters.
Yeah, I think things like anything that's like fact-based, fair game, anything related to like stories about healthcare experiences is fair game. And I think that the only area that gets dicey is that supporting of political candidates. I know this because I also help with our some of our Illinois chapters Twitter stuff. And then the other thing that I would be just a little bit make sure that your stances align with like PNHP stance on certain issues. I would say, I think the one issue that came up recently was for the Illinois Single Payer Coalition, we had like one or two members who were anti-abortion, but our official, chapter's position is a pro-choice one. So, just making sure that your social media, like your content related to those issues in healthcare, is in line with PNHP's mission. Is my advice. Nadine?
Hi. Is there a dominant social media, or is there even such a thing? I know there's Facebook, Instagram, Twitter is one, or do you have to hit them all to cover all your demographics you want to hit? Or is Facebook really dying like I kind of heard? Just wondered.
That's a great question. I think the demographics are shifting, and I think you're totally right. Those are the three most used social media platforms. I don't think Facebook is dying. I think that Facebook is now used by people who are in an older demographic than people who are on Instagram, and TikTok is like, I'm not on TikTok. That's like I think the Gen Zers, the generation beneath me. So I think every few years, like 5 to 10 years, we're going to see a new platform come up. I think like pick the one you're most comfortable with and go for it. I think it was Patty who was saying like Facebook. A lot of people between the age of 50 to 75 are on Facebook, and those are the people who vote. Those are the people who need to be convinced that Medicare for all is something we should support. So if y'all are on Facebook, like use Facebook as your platform.
Oh, cool. Thank you.
All right. I will be in the chat if any other people have questions, but I'm going to hand it off to Ed.
Hi, thank you, Dixon and Dr. Maalouf. So I was the social media for SNAP last year. And to be honest, I wish Dixon had this sort of training when I started, because this is super useful. But I'll be going over how to make graphics and using this thing called Canva I use that Dixon also uses to make graphics. So I'll go over that. Let me share my screen. Okay. Okay, so let me. So I made this graphic last night. It took me like 30 or 40 minutes. It says Medicare turns 57, obviously for the anniversary on, I believe, July 30th. And then I put, just as Medicare safeguards the health of our seniors, we must safeguard Medicare for ourselves and for future generations. Just some clever wordplay. And I have this image to evoke some, sentiments, to evoke our view of Medicare as one of care and compassion, and not as, money signs as our private equity friends would see Medicare as. And if you were to go on to Snap into our Instagram, which I managed last year as well, you can see some of the stuff we posted. Like we posted memes, because memes are popular and they're graphics and they easily convey information using images and short sentences. I was a big fan of like satirical type of humor. And, I was like one of those kids who read the Sunday cartoons, and I was a big fan of like those political cartoons. So I tried imitating those stuff as well. These are flyers this was a flyer for the Snap Summit that I made. And, all of these I made using Canva over the last year. And yeah, so now I'll go over how I made these things. So first we would log on to Canva. If you don't have access, everyone has, Canva is free, but in order to use have full access to it, you need Canva Pro, which I think Dixon, if you ask Dixon, he'll probably share his account, right, Dixon? Using Canva Pro. Okay, so Dixon gave us a thumbs up on that, so that's great. So right when you log on to Canva, you're going to press create a design. I personally use Instagram posts and because it's a square, and if you do like a rectangle, it's not going to post well onto Instagram because Instagram likes squares. That's something you'll just learn from experience. So yeah, so I'm just going to go over the features and like how I made that graphic. And before I start, I just want to say like, making these graphics, it does require like a little bit of creativity. It's like forming an idea and then finding a way to execute that idea into, while you're doing that, to think of your target audience. And it requires a bit of creativity, some imagination, and some design, which, some of you may find intuitive, some may not. But anyways, so let's get started. So I'm going to press, to put in a little text box. I just go on to text and add a heading. And what did I wrote? Like Medicare turns 7, right? So that's just typing. This is the default font. Let's say you want a cooler looking font, you could scroll down and look for a cooler looking font. Honestly, for me, I just like using clear fonts. I don't like using cursive like this. That's just way too like hard to read. So let's say, I don't know, Anton. And when you choose font, you want to choose it based on like if you want to convey a serious message or you want to convey a funny or satirical message, then you can use like font like this one, Bangers. I think I've used that font before. It's a fun font to use, but let's go back to whatever I was using, Anton. Okay, so, and then you could also change the color. I like using red because red is a very noticeable color. It pops up really well, right? And then what else did I write? I think I also wrote like, just as Medicare safeguards. So safeguards health, safeguard future generations. So I wrote something like that, and I bolded it. I like to bold stuff to make it like pop out more, and I'm gonna choose like blue. And then let's see, for the image, in order to put an image on Canva, you go on to elements, and then here it literally says search anything from Canva. I think I put like, let's see, what did I search up? Like hand holding. Okay, so then I went to photos in order to find that image that I found. I think it was this one actually. Okay, so let me so I'm gonna crop this image. And so it's only the hands, maybe do something like that. Done, and then I'm gonna expand it, something like that. And then you can also change the transparency. Changing the transparency so the words would pop up more. So you could change it from 0 to 100. I probably chose something around like 70 or 60. And so, yeah, I believe I went over the basic functions of Canva. And this is just a demonstration. Also, there are some times where you want to add an image onto Canva, but it's not on the Canva. So let's say you wanted to use a PNHP logo that obviously Canva does not have. So in order to post a picture onto Canva that Canva doesn't have, I would just go onto Google Images and search like PNHP, go to Google Images. Let's say I want this image. So what I'm going to do is I'm going to screenshot it. I'm going to screenshot it, and then I'm going to crop out the part where, oops, sorry, let me crop it out right there. Crop it like that. Press done. Oops. Go back. Then we are going to go to uploads, upload media, and then I believe this is the image I just saved. So it pops up here. I'm going to click on it, and then oops, there it goes. So so this is just putting an image that's not on Canva. Obviously, Canva will not have our logo, and then this is we could put it here on the bottom. So yeah, do you have any questions? That's like the basics of Canva. Let's say you don't like this background. Let's see, you can go into backgrounds here. Let's say you wanted a more celebratory approach to celebrating the 70th anniversary, or sorry, the 57th anniversary of Medicare. You could click on backgrounds, click, do something like that. And then to make this pop out more, you would change the color to maybe white, So yeah, I just went over briefly how to use Canva. It might have been a little quick, and but honestly, if you just play around with it, I think you'll get it. It's not terribly difficult, and I had a lot of fun using Canva. So yeah, let me stop sharing my screen if I can figure out how to do that.
This was awesome. I think, for the people, I think it was Nancy earlier, like this would be a great thing to assign, one of your, if people have a social media team, assign somebody to spend some time on Canva and maybe watch Ed's tutorial, the video of it, and spend some time on Canva making some graphics.
Oh, by the way, if you have any questions, you can email me. Let me just put my email in the chat.
Yeah, and that was so thank you, Dr. Maalouf, for, noting that there's the potential for collaboration here. Another thing that you could use it for, if somebody in your chapter has written an op-ed, for example, a really simple thing that you can do on Canva is pull a quote, a single sentence, something that you really want to highlight, and ask your, Canva proficient volunteer to turn that into a graphic that you can put on social media. So like Dr. Maalouf was saying earlier, visual content really resonates. That's something you can use this for as well. But does anyone have questions for Edward?
Nancy, you have a question?
What is the advantage of the pro version versus the plain?
Yeah, so the Pro gives you more access to like fonts, more access to images, that sort of things, just more features. I mean, theoretically, yeah, you can use just a free one, but you're just limited to what font and images you can use. But like I said, you could technically steal images off Google, like I showed you. So, but I'm pretty sure Dixon will definitely share you the account, right, Dixon? Yeah. So I hope that answered your question.
I put my email in the chat, so if anybody has a chapter account and they're interested in being on, our Canva account, send me an email. Let me know who to send the invite to, and it's very simple.
Did you have a question, Corin? Oh, I think you're muted.
Thank you. This was really fun, and I still need a lot of help. So would it be possible to have a in-person workshop at the national conference where we could sit in front of a computer and actually do a multisensory training session? Because even if you're used to this, but that arrow went flying through across tiny little images. And so it would be great to consider one of the workshops to be a actual hands-on, make your own social media image or whatever, as a practice. So
Yeah,
just something to consider.
I would
I
totally
don't know who's in charge of
that, but
pardon, Ed?
Oh, I was just saying I would totally be down to help out with that, but I'm not in charge of like the national, I think the national PNHP summit is in November. I'm not sure who's in charge of that, but maybe we can go ask ask who does who, and then we can schedule that in. But yeah, definitely Betty said it, it'd be easier, but not everyone can fly out to Boston, I believe.
I think it will require a number of avenues to learn it, and Zoom is great, but an in-person would be great for those of us who can come. I don't know who's in charge of setting up the program because I have some other ideas too for the national conference. Ken, who would we contact?
If you have ideas about the national conference, you should email Matt Petty. It's okay. Matt at PNHP.
Thank you very much.
I believe William Bronston had a question.
It's not a question. I just wanted to contribute something that when the group of us put together the California Lifetime Healthcare Act policy model, we were contacted by an Indian web page developer who charged us under $300. They've been working with us for a whole year. I talked with them almost a half an hour every day. The work they did was brilliant, and they were able to help us rob copyright photographs and remove the copyright overlay from Google and all those. So I'm going to put the website up. It's called zonewebsite.com. These guys are absolutely incredible. I've worked with them extensively, and the quality of their work is brilliant. And if you want to check it out, look at calcha.org, which shows the work that they did over a period of about 3 months, talking to me on the phone one-on-one every single day in order to refine the model. So I'm just going to pump this up here just so people, I'm not hitting return, but anyway, it's called Zone Websites, just like it sounds.com. And you're looking for Victor. Amazing, amazing resource. Little bit of money, but incredibly inexpensive, given what websites cost here.
Yeah, that'd definitely be something to consider. Thank you. Does anyone else have any questions?
All right, so it looks like we don't have any other hands raised, and I see we are coming up to the end of our time here, but I want to thank everybody for joining today. We had a really good turnout, and it's very encouraging to see so much enthusiasm for and interest in social media. So I know some people put links in the chat for accounts that they're running. Again, I'd encourage you to follow those if you're not already. And I just put 2 quick links in the chat for Canva trainings. There's one on the Canva website where there's a couple of exercises that you can do. It's interactive, very short videos followed by some interactive exercises that can help get you up to speed. And then there's another, lengthier set of Canva themed YouTube videos that you can watch if you're interested. So, but we will be sure to get the recording of this to everybody this week. Thank you all. And let's be sure to use this tool for good. Thank you to Dr. Maalouf. Thank you to Edward, and thank you to all of you, and onward.